Long COVID is a great challenge in the world at the moment. We get patients from all over the world, and they come with various symptoms, ranging from fatigue to neurological symptoms or gastrointestinal issues. And these symptoms sometimes last not only weeks but months. Some people cannot work anymore, they're really deliberated and they cannot function anymore. So today it is my great pleasure to have my interview partner here, Dr. Leo, our leading doctor at the Paracelsus Clinic, and I would like to ask her some questions about long COVID. Welcome, Dr. Leo.
Hello.
My first question is, Dr. Leo, what are the most common symptoms you see with patients coming to our clinic?
So most commonly they will show chronic fatigue, they will show brain fog, muscle pain, breathing problems sometimes, also intestinal discomfort, and just a general lack of energy. So the whole system doesn't function properly.
Dr. Leo, we at the Paracelsus Clinic, we understand long COVID as a post-viral dysregulation affecting many systems of the body. And there was a paper published recently in Medical Nature that looked at over 700,000 people, and they found that in patients with long COVID, more than 10 body systems are involved. So this is, my question is, how can one disease affect so many systems in the body at once?
Yeah, this is really true. So we see that the regulation of the entire system is disrupted. So not only circulatory, but also the neurological, the autonomic nervous system, the metabolic system, the immune system, everything is in a chaotic situation. So they cannot work together, and this causes many conditions, more than just one disease. It's like it's affecting many systems. Yes, this has to do with the regulation of the inner milieu and of the working together of all the systems in a harmony.
So at the same time, many systems are involved, and is it also because of the inflammation of the various body systems?
Exactly. The inflammation is a very important factor. In the normal condition, the inflammation needs to be sometimes turned on, but then also turned off when the infection is over. It needs to be finished. But in these viral diseases, here we see that the inflammatory state continues long term. Even weeks and months after, there's still the inflammation there, so it has not been shut off. And this is the key why the system is failing.
Okay, so like you said, that's a regulation blockage, that the information is not switched off.
Yes.
Okay.
Right.
Okay. At Paracelsus, we have worked for decades with people with chronic viral load. We sometimes call it, or bacterial load, like Lyme disease. We had many patients always coming for Lyme, or still come for Lyme disease. So we have experience with this post-viral dysregulation. Has this experience at the Paracelsus Clinic helped us to deal with long COVID patients?
Yes, definitely. There's basically all the same mechanisms working also in COVID. So we have this experience in the background with, as you say, with Lyme disease, with chronic Epstein-Barr infection. They are all known to us, and we have basic principal ways to deal with them, which are also right now in COVID.
So there's also a regulation blockage, also to do with inflammation. It's the same sort of picture.
Right.
This is, Dr. Leo, this is very interesting that you said that in long COVID there's this inflammation that cannot be switched off. So this is like a systemic inflammation in the body. How is the influence of this systemic inflammation on the immune system and the vascular system? Because in long COVID, the vascular system is also involved. And then also the speciality in long COVID is also the neuroinflammation. Mm-hmm. So how does this manifest in our patients?
Yeah. So what we see is from the immune system, we can see that there is overreaction and there is also sometimes no reaction at all. We see a lot of autoimmunity, so that even the body starts to react against his own tissue. This is all factors of the immune system that is completely dysregulated. It also affects the vascular system by producing these microclots in the vessels, and this is mostly due to the spikes themselves clotting. But also it gives an irritation to the coagulation system, so that microclots start to be produced inside the vessels. This leads to leaking of the vessels, this leads to open brain barrier, and this way also to inflammation of the brain. Then there is also the factor that there is the ACE receptors in the vascular system, and in the brain it's the nicotine receptors. And both of them are affected by the spike protein. And the spike protein can, through these receptors, completely can disturb memory, cause brain fog, cause sleeplessness, cause concentration troubles, can cause all kind of neurological disturbances, also pain, for example. We have also seen MS cases, which all of a sudden produce an exacerbation through the COVID. So this is really affecting every system in the body.
So how I can understand it, so the spike protein itself can block the receptor.
Exactly.
The acetylcholine receptor.
Yeah. So it's the ACE receptor, and there's also the nicotine receptor. And both in their different functions cause the different troubles in the body.
Mm-hmm. And it just blocks the receptor, and then all the functions what the receptor normally doesn't work anymore.
Are blocked. Yeah.
Are blocked.
Exactly.
Okay. And so the neurological problems in long COVID is really, really, we see in our patients really bad, and they're not functioning anymore. So what is our approach to help these people? How can we unblock? How can we unblock the receptor?
Yes. So there's one thing that the science has found. This is the nicotine patch. This is like exactly fitting into this nicotine receptor, acetylcholine receptor, and can this way throw out the spike protein. And this way the receptor is being unblocked. But we also need to clear up the spike proteins as all. So we have to use infusions, we have to use apheresis, different methods to get rid of the spike protein.
So the nicotine comes along and then chucks out the spike protein, and then it doesn't stay in there. So it also leaves.
It has not the same long attachment time as the spike protein. The spike protein doesn't go away at all, but the nicotine will go away eventually. Mm-hmm. Yes, and that's why it can really release. And I've seen patients that, like, within a day, the speaking became normal again. Their brain function was affected. Yes, better.
Wow! After the nicotine patches.
Yeah. Sometimes in one day.
In one day.
Yes.
Okay. What is normally? How long does it normally take?
It's we see very different results, yes. But one study, they show that they use it for 1 week, and then within 3 weeks, many symptoms would go away.
Mm-hmm. Mm-hmm. Okay. So with this receptor blockage, the microcirculation is affected. So how does this play out in the body? So, and how are the mitochondria involved? And is this why patients feel so tired and completely exhausted?
Mm-hmm. Yeah, this is exactly right. So through the blockage of the vessels, of course, there's no oxygen delivery after that. So already there's a lack in oxygenation of the tissue. And then also the COVID affects directly the mitochondria. So they are malfunctioning, plus no oxygen. So this causes really the low energy state in which we see many patients.
So the mitochondria are affected directly?
Yes, exactly. They are affected directly and indirectly by not receiving the oxygen, and this way they don't produce the energy that they are supposed to do.
Mm-hmm. How do we know which system is affected? How does our diagnostics look like?
Mm-hmm. So we really want to see an overview of all the systems. So we do a diagnostic of the inner milieu. We want to see especially the regulation blockages, because then we can find out where to start the treatment. So we will definitely check the heavy metal load. We will do dark field diagnostics. We will do laboratory work, of course, also. We can do thermography. So with thermography we can see the temperature regulation blockages. And yes, and VNS for the autonomic nervous system. So we have many ways to know the condition of the inner milieu and of the regulation.
So I heard you saying before that the inner milieu is the interstitial space, and the regulation blockages are mostly the cause of it is in the milieu. So we test the inner milieu and then see how the regulation blockages look like, and then there is specific diagnostics individually for every patient to find out what the problem is.
Right, exactly.
So it is very individualized.
Exactly. So my experience is there's not two COVID patients who are the same. They have their own pattern, their own. Each one has his own system that is failing more than others. In this person different than from another person. This really depends on the condition before he even had COVID. Mm-hmm. What is most affected?
Okay. And toxins, does toxins play a role in Lyme?
Yeah, yes, of course.
Mm-hmm.
Heavy metals are very commonly still cause for regulation blockages. Then is the question where they're from. Is this a dental problem? Is this a problem of eating foods that are toxic?
Can we also test for spike proteins? Or?
Yeah, we do of course, in the lab we can test the spike proteins. We can see before and after whether they are, how they are, whether they are coming down.
Mm-hmm. So the whole diagnostics is a very intensive approach to find ways professionally to find what are the root causes.
Yes, right. Mm-hmm. It's like a puzzle.
Yeah.
Putting together a puzzle to see what are the specific parts for this patient that he individually needs a treatment.
Okay.
So there's not a standard treatment that we give to everyone.
And then the treatment approach, I understand because it's very individualized. Now the treatment is also but what are the main treatments that we offer in the clinic?
I mean, definitely the detoxification systems, like heavy metal detoxification. We can do liver detox, even detox weeks that we really cleanse the liver so it functions well. We have the biofilm weeks for the detoxification of biofilm, so that the immune system in the intestine can properly function. We have infusions, we have hypothermia, we have many tools to work with.
And one of the patients we had, I remember, the plasma apheresis really helped the patient.
Yes, exactly.
And he went skiing again afterwards.
Yes. So yes, apheresis is one of the more modern tools that we have now. that is to really wash the blood, basically. So the plasma is separated from the particles and can be sent through a filter, and then all these bigger parts, they can be kept in the filter.
So the question often is, can plasmapheresis filter spike proteins? So people even post-vax syndrome, can that also help?
There's a yes and no, because on one hand they are very small, but on the other hand they are also clotting together. So if they're just a single spike protein is too small, it will just go through the filter. But once they make little clots, they will stick in, or when they're attached to other proteins, they will stick.
So people, when they have long-term problems and nobody can help them, often plasmapheresis can help to for the initial.
We really have seen improvement through the apheresis. Yes.
But it's never only one treatment, and all the other treatments together with...
Exactly.
Yeah.
Exactly. You need to combine it with different treatments. It's not just apheresis, it's a miracle tool.
Can you also directly detox bacteria and virus?
Yeah, we have various ways to get rid of them. Yes, like ozone treatments, different other treatments, also remedies that are directly targeting this.
These bacteria.
Yes.
Okay, and then because the immune system and the gastrointestinal tract is so involved in long COVID, which is our second pillar of biological medicine. So how do we treat patients affecting the gastrointestinal tract? You already mentioned the biofilm.
Yes.
And how can we support the immune system via the gut?
I mean, we basically need to really reset the intestine, and this is a big portion is just to change eating habits. This might be very necessary. And then by releasing the burden on the intestine, they can heal. The mucosa can heal, the leaky gut can heal, the dysbiosis can be addressed. We can do colonics, we can do the biofilm, as I mentioned. This is very important, as also in Lyme, for example. This is one of the most important tools that the biofilm can be taken out, because this is like the hiding place for them. What
are other treatments? You mentioned the oxyven or the ozone?
The ozone treatment to directly destroy viruses, but we do want to use also oxygenation therapy as an anti-inflammatory tool, as a detox, and we also want to use it for oxygen delivery. So we do have IHHT, which is a breathing oxygen in high and low amounts, hypoxy treatment. And this can be also very specifically be used in Lyme disease, but then in the mitochondrial medicine to increase the function of the mitochondria.
So also in long COVID, not only Lyme.
It will be one of the main
treatments. So the IHHT treats the mitochondria by destroying the weak ones, I think.
Yes, that's right.
And the good ones will be
able to propagate better. Yes, exactly.
So this is a direct treatment for the mitochondria.
Yeah.
So with these kind of treatments, does the inflammation decrease?
Yes, that is the goal. That would be the goal.
So the main aim is to decrease this chronic state of inflammation.
Exactly.
And one aspect is to regulate that the receptors get regulated again, so it can actually switch off the inflammation again.
Exactly. That is like the switch that is really responsible for inflammation there.
Now we have very professional apparatus and machines here at the clinic. How can we also support the patients to regenerate? Is there any special infusion, or how can we regenerate the patient with long COVID?
Yes, we do have different infusions to regenerate the patient, especially also vitamin C and also all the parts in this infusion of the build-up infusions. And they directly support the vascular system and also the inner organs through homeopathic remedies. And then we also give orally macronutrients to restore mitochondrial function. And we do also regenerate the intestine, leaky gut, and so on. This all need to be healed by giving nutrients, right? Proper eating again. Yes.
So it's a quite comprehensive treatment approach to detox, and then also the gastrointestinal tract and the immune system, and then also regenerate.
Yes.
Yes.
Our 3 pillars
of the biological medicine. Yes.
Exactly.
Thank you very much, Dr. Leo, for explaining about long COVID and how we treat it here at the Paracelsus Clinic.
Yes.
Thank you. It was very interesting.
You're welcome.
And please continue your good work.
Yes. Thank you.
So what we learned today is that long COVID affects many systems in the body, and therefore there are these very long list of symptoms that patients with long COVID experience. And here at the Paracelsus Clinic, we look at each different system. We have very professional diagnostics to find which system is involved, and then also have a very structural approach to have a treatment approach to first look at the detoxification and the immune system, and then also to regenerate the person. And what's very special here at the Paracelsus Clinic is what Dr. Leo mentioned, is that the inner milieu is first of all diagnosed and then also treated to so the body can start regulating again. So this is very, very interesting. And to find out more about this interdisciplinary approach to long COVID, to the holistic approach we have here at the Paracelsus Clinic, in our future series, I will talk to a nutritionist, a therapist, and a dentist, and maybe even a nurse, to see how this long COVID disease is approached from all sides. And thank you very much for listening and watching, and we'll see you soon.